When we talk about lung cancer has a couple different flavors. You can have a single spot, or the doctor could tell you that it has metastasized. That means it's spread to other areas. It's important to know that. It's also important to know that as of today, as we talk about black-white disparities in the United States, that there is a disparity in metastatic disease, to be quite honest with you. White patients who are receiving biomarker testing are receiving it at a much higher level, particularly when they're metastatic compared to African Americans. This is an issue, and this is a gap that absolutely must be closed. But that gap gets closed by two different mechanisms. One, by organizations bringing it to the attention of health systems that we ought to be doing more testing. This is the ask first. Most African American patients aren't asked if they want to be biomarker tested or if they even want to be in clinical trials. Just true. But two, this is the importance of education. And when we say education in particular, I mean that every patient, Black, white, Asian, Latino, every patient should be armed with the fact of the power that biomarkers actually give us in designing precise medicines for you. So yeah, metastasis, because most people are afraid of that word. It used to be when people said, "Doc, what do I have?" and give it to me straight. And you said, "Well, yep, I saw a spot and it's also spread all over your body." The next answer would be, "Oh my God, there's nothing to be done." That's no longer the case. Biomarker testing have shown us that extensive disease, extensive lung disease, PD-L1 markers and other things like that, with some of the therapies we have, actually you can go from advanced to someone who's not just surviving cancer, but thriving. How do we get to the gap? First, we have to recognize that there's a difference. We have to recognize that there is a gap. Second, we have to have the will to figure this out, and that's not going to come just through good gestures. It will come through policy changes at hospitals that are going to require health systems to do more testing. But as a patient, you too have power. You have the power of, before you step into the hospital, before you step into the clinic office, to be educated about the power of biomarkers, and you also have the power to request them up front. We're going to change this together. Both physicians, folks like me, actually advocating that health systems offer more biomarker testing to everyone. We're going to change it with you, with knowing that you have the power to simply request, "Doc, are you going to run a biomarker panel on me as well?" And the truth of the matter is, whether you have a single spot on your lung, or it turns out that you have cancer that has spread, there's treatment for you, which means these biomarkers are particularly important. That's how we're going to close the gap.